best thing about being a doctor is the opportunity to sit down with patients and their families and really understand what it is that's really troubling them. I love the question, what is it that's bothering you most? Sometimes the answer surprises you. Maybe a patient was sent to you for one issue, but when you really sit down with them and you ask them that question, they give you a different answer than you expected. And then you can work with the patient, their spouse, their children, and try to figure out how can we solve the problem that's bothering you most. And it might not be a medical problem, but maybe we can still identify the problem and push them to the right direction. I think many neurologists, especially people interested in geriatric neurologists, also find that they deal with family issues and family dynamics. So it's not uncommon in my clinic for me to be talking to the patient, but also be talking to their spouse, maybe a child, maybe 3 of their children. And we're really working as a family to help figure out what are the big issues that are facing us. Are these issues that we can treat and make better, or are there issues that we're facing that are just going to continue to gradually get worse? And what we really need to do is make a plan for the future to help the patient, but also their spouse, their children, deal with what's going to come in the future. I might have a patient who's only 50 years old and they would like to keep their job and keep working, and they're having some severe problems with pain issues or walking, and maybe we can figure out what kind of surgical treatment they can have to allow them to continue their extremely active life, raising their children, working. Or I might have a patient who's much older, who's 83, and their goal is, I'd like to go on one more cruise with my family. I'd like to make it to my daughter's wedding. And so I think I'm always inspired by people revealing what it is that they really want, what's important to them. And then I love to see how families can get together. Once they figure out what that goal is, families can get together and help that person achieve the goal.